Hi, I'm Dr. Sandra Elmer. I'm a urologist and a women's pelvic specialist, and I'm very proud to be part of the endota wellbeing conversation. I'm a urologist and I have a special interest in female pelvic medicine and reconstructive surgery. I love advocating for women's health and helping them through the journey, through life and all the different life stages they may face with their pelvic health. In this conversation, we explore how environmental factors, such as stress and endocrine disruptors, may influence women's hormonal systems and pelvic health. We'll also discuss simple lifestyle tips that help navigate these factors and support our long-term well-being. Environmental factors play a huge role in pelvic health and sexual function. Environmental factors may be psychological stresses or chemical stresses. So the psychological stresses such as chronic stress, anxiety, poor sleep, burnout, we know that activates the autonomic nervous system and it can cause that flight or fight response or guarding mechanism that causes the pelvic floor to contract. When the pelvic floor contracts inappropriately, this can lead to pelvic pain or issues with your urinary, sexual or bowel function, such as urinary urgency, frequency or pain when you pass urine, pain with penetration, and bowels you may feel like you can't defecate properly. So medications, alcohol, smoking, all these things may disrupt our endocrine system, and really they may affect our hormonal status as well. Endocrine disruptors may indirectly affect ovarian function. It may affect reproductive hormone function. It may affect things like the age of menopause. And if these endocrine disruptors then affect your hormone production, theoretically they could then lead on to cause symptoms of estrogen deficiency. Common exposures that may affect a woman's pelvic function or sexual function include poor sleep or stress, drinking too much caffeine, voiding when you don't have to. You should not do just in case wheeze. From a sexual function point of view, clenching your pelvic floor when you don't need to can actually cause pain with intercourse because your pelvic floor is too tight. And the other thing that can affect your bowel is if you've got chronic constipation, and so diet feeds into that. Exposure to irritants that can affect or disturb the natural pH of the vagina or vulva are really important too. So we should be avoiding perfumed or fragranced vaginal cleansers or soaps which can dry out the skin, even liners or certain types of synthetic underwear. The practical steps that women can take to reduce environmental stresses that may affect their pelvic health are lifestyle changes. Make sure you're eating healthily, exercise regularly, and getting good sleep. From a hormonal point of view, are you going through peri or postmenopause? Is this affecting your pelvic health? Maybe you should go and see your GP about this. In your diet, reduce caffeine if you can, and have good pelvic and bladder and bowel habits. Drink an appropriate amount of fluid a day, void regularly, don't do just in case wheeze. And from a bowel point of view, have a high fibre diet and make sure you're having regular bowel motions and not straining to pass a bowel motion. Understanding how the body works helps us care for it more intentionally. Explore more simple ways to support your health and longevity with the endota wellbeing conversation.